Hi everyone, welcome to What Mental. i- Is it just okay? I think I okay. I'll cut out this part. Hi everyone, welcome to Words for Mental Health. This is a digital mental health advocacy platform, and today we have Dr. Lakshmi with us. She's the head of Department of Rehabilitation at Schizophrenia Research Foundation, Chennai. Welcome, Dr. Lakshmi.
Good morning, Shrishti.
How are you?
I'm good, thank you. It's a pleasure to be here. Thank you for having me on this platform.
It's a pleasure to host you, ma'am. Um, Ma'am, can you share your professional journey so far and your journey with Scarf?
Okay. Um, Maybe I'll start off with telling a little bit about Scarf, and then I'll go into my
Sure.
who I am and my relationship with Scarf, if that's okay for you.
Yeah, sure.
Um, Scarf, as you already said, Schizophrenia Research Foundation India is a not-for-profit, non-governmental organization, and it's been around for 40 plus years. In fact, we just completed 40 years and we have gone into our 41st year. And it was started by three very energetic, enthusiastic psychiatrists who thought that there is a need for focusing on not just providing medical treatment, but also on rehabilitation for this illness, schizophrenia. So, Dr. Sharda Menon, one of the first women psychiatrists in the country, Dr. Raj Kumar, and Dr. Tara were instrumental in bringing SCARF into existence. And whilst the primary aim was to provide rehabilitation, there was also a very important need to provide local evidence on what works, what doesn't work in our context. So, research also became a very important element of SCARF's operations. So, from that time to now, SCARF has gradually grown. We do a lot of clinical work. We provide outpatient clinical services. There's also dedicated teams to look after patients who require to stay in hospital. A team also goes out into the community to provide care at the doorsteps. We also have um, looked at a age-related care model. So we have now a youth mental health team which focuses on the young people. We have the general adult psychiatry, which still looks after people in their working age groups, and there is now an elder care psychiatry service. So each of these service provides mental health care and treatment to people in those age groups. Whilst we originally started focusing on schizophrenia and other psychotic illnesses, now we provide treatment for any mental illness. We have multidisciplinary teams, so we have psychiatrists, psychologists, social workers, occupational therapists. We also have, of course, the nursing team without whom the inpatient service cannot run. We have a day hospital both for the adult population and for the elders. There's also a drop-in center for the young people known as the Resource Center for Youth Mental Health. So there's a lot of services that we offer, but psychosocial rehabilitation still remains a very important component of what SCARF offers. Maybe as we talk further, I will give you more details around that. And I've been with SCARF for the last 12 to 13 years, and I have had huge interest in psychosocial rehabilitation. So in the last few years, I've been leading this service at SCARF. And SCARF is based in Chennai. There's been a conscious decision to have the base here in Chennai and not really have branches. So sometimes we work in the community depending on the needs of the community as well.
Mhm. I'm a little bit about your educational journey as well.
Okay. I've been a psychiatrist now for 25 years and more. So that will disclose my age to
Yes,
you.
yes, I think.
Um, I trained in Chennai in the Institute of Mental Health attached to Madras Medical College. I did my diploma in psychological medicine there. Then I went to the UK and I did my membership of the Royal College exams. I worked there as a consultant. I trained specially in general adult psychiatry and eating disorders, and I came back about, like I said, 12 years ago and joined SCARF, and I've stayed with it since.
Right. Thank you so much. I was not sure if it is a psychiatry MBBS MD doctor or is it PhD doctor. I did not know, so I clarified that. So thank you for so humbly clarifying that, ma'am. Uh, this is what I love about Scarf team. Everyone is so humble and grounded. Everyone. No one takes offense at any cross questions. That's the culture I've witnessed over the years with Scarf, and I think it's very, very promising. So now we can get into the topic. Ma'am, I would like to start with asking on the behalf of the common audience or young budding professionals who are not fully aware, because people's knowledge is limited to something happens. I think in India it goes like something happens, go to the astrologer. The astrologers, give some remedies, wait for 6 months, remedies fail, illness intensifies intensely, then they go to some doctor. After going to some doctor, the doctor says go to a psychiatrist, and that is if the doctor believes in referring the patient out. Sometimes general physicians are treating psychosis or other severe mental illness, and then the patient reaches the psychiatrist. By the time the symptoms have also become rather intense. So, this is the typical pattern that people are aware of. And then, if the patient with the severe chronic mental illness reaches a psychologist, the training says if you're a counseling psychologist, if you're organizational psychologist, etc., then you're not even qualified, or even as a counseling psychologist, not qualified to even talk to the patient. It's very discouraging the way the education is given, because a big population, at some point we are all going to come across someone with a chronic severe mental illness, and we need to know how to navigate that particular space. So for those who don't know a little, why is psychosocial care so important for those with chronic and severe mental illnesses, and why how is it particularly helpful in schizophrenia rehabilitation, and what happens when to the symptoms of the disease when there is very proper psychosocial care that is involved. So these are my first few questions.
Okay. Um, Gosh. Um, I think you have um, almost hit the nail on the head, I would say, when you said that people flounder before they reach out to the right services for help for severe mental illness. There's still a lot of stigma about seeking psychiatric help. People also have lots of myths about what mental illness is, why it happens, and who can potentially help the person who's going through the illness. So that definitely delays the treatment access. And when treatment is not started promptly, then that sadly has an impact on how well the person recovers and returns back to a reasonable functioning stage. Now, even if a patient reaches a psychiatrist and takes treatment for the severe mental illness, as you know, schizophrenia has multiple components of symptomatology. One group of symptoms is what we are all often hearing about and seeing being displayed in movies, which is hearing voices, talking to oneself, or being very paranoid that some harm is about to happen to them, someone is watching them, someone is controlling them. These we call as positive psychotic symptoms, which are very prominent and can be distressing and distracting for the individual and has an impact on the functioning. But there are two other groups of symptoms which sometimes are not really focused on by people out there, and that is the negative symptoms and the cognitive symptoms. And by negative symptoms, we refer to the cluster of problems which we all face in terms of how we engage with the community. The social connectedness, the emotional warmth that we all have, and the ability to function optimally, whether it is academics or work. Being able to express ourselves, communicate well, having motivation to do things. Now these are all features that all of us have, but sadly when someone develops an illness like schizophrenia, they lose their ability to emote well. Their emotional response to situations is blunted. They don't talk much, they don't interact and communicate and engage with people around them. Their motivation to do things are reduced, and their functionality, whatever aspect of their life, is also reduced. And these we call as the negative symptoms. And then the cognitive symptoms are ability to concentrate, ability to retain information, process information, and also problem solve, and move from task to task when we need to. And these are all cognitive abilities which are also affected in schizophrenia. And as of now, whilst medications that we have, because schizophrenia and psychotic illnesses are brain problems, they respond to treatment, particularly with medications. So that is the first line of treatment for these illnesses. But there are all these negative symptoms and cognitive symptoms which don't respond very well to medications. We've not reached a stage to identify medications which target these. There's a lot of research happening in that area, though. So we do need to focus on how we can help the persons recover from their negative symptoms and their cognitive symptoms to be able to function, live their lives with dignity, and be respected as a contributing member of the family and society. So, psychosocial interventions become extremely important for that.
One question here. So, a lot of people don't understand the dignity component, right? So, can you elaborate on how a patient's dignity can become compromised if the proper rehabilitative care is not given, with some examples, so that the common public or young budding professionals can understand the importance of what good quality care, that is the all-round care, can do for a patient.
Right. Um, I think there's dignity at different levels, right? Before I come to dignity, we also need to talk about the rights of people with mental illness. Yeah. Um, we are India is a signatory to the UNCRPD, and people with disability have rights. So, what do I mean by rights? A person with mental disability still has the right to live where they want, do what they want, and lead a respected life, be able to access treatment, be able to access effective treatment, and also treatment which is not very expensive. So these are all some of the rights. There are, of course, a lot more rights. Now, the individual who has an illness has also a right to understand what their illness is and to make decisions about whether they want to participate in the specific treatment being recommended. But for that, they need to understand what their choices are, what else is available for them, right? So, a person with mental illness has to be able to engage in the treatment process. Now, in the community, living with families, just because they have an illness does not mean that they cannot participate in decision making, important decisions that are being made by the family. So, if, for example, the family is discussing changing their house or attending a particular function, sometimes when a person has mental illness, they're excluded from those conversations. They are not engaging in major decisions that involve everybody who is living in the household because they have the illness. Now, that is affecting their dignity. Now, when the person has to make decisions about what kind of course they want to take or what job they want to do, sometimes others make decisions for them, not just about treatment, but also about all these other important matters, which we all make decisions for ourselves. So, people with mental illness, so long as they have the capacity to make decisions, should be encouraged and supported to make decisions about their life and what matters to them, and that makes them live with dignity. There is respect being accorded to them for who they are. The illness does not define the person in totality. They are more than just the illness. They may be the son, the daughter, the sister, the brother, the wife, the husband, the child, an employee, an employer. They still have other roles and responsibilities that they play in the society, and all those roles should be um, permissible for the individual to pursue and shouldn't be stopped just because they have contracted an illness over which they don't have a control. And that's what living a life with dignity. I mean, that they still can choose where they live and how they live their life and take some responsibility for their treatment. And that's very important for people.
People often believe that if there's a severe mental illness that is that has been diagnosed, the person's decision making capacity or their capacity to reflect on what is actually in their best interest, that can be a little diminished. That is the popular opinion. So what happens in cases where patients might not be able to make the best decision, especially when the symptom is at its peak?
Sure. Um, just like we are signatory to the UNCRPD, based on now India has its own Mental Health Care Act of 2017, which tries to protect the rights of persons with mental illness. So, under this act, every person with a mental illness is presumed to have capacity, and it falls on the mental health professionals to demonstrate that someone does not have capacity to make decisions about their treatment. When a person does not have capacity to make decisions about their treatment and they're severely unwell, and that they are at a risk to themselves or others or their welfare, then we can proceed to help them with the mental health treatment against their wishes. But there are provisions in place to make sure that this is periodically reviewed, and every time the person regains their capacity, then they are allowed to participate in the decision making once again. The family is involved in those circumstances when the person lacks capacity. So that's known as a supported decision making. So there are legal provisions in place to ensure that the person's rights are still respected and protected.
Right. Thank you for clarifying. Um, Now, back to the original question of the psychosocial rehabilitation, what it looks like, why it is especially beneficial for schizophrenia, and what are some of the other severe disorders where um, the intervention seems to bring a great impact on the symptomatology.
Okay. I mentioned earlier about positive symptoms, negative symptoms, and cognitive symptoms. Now, all of these, we can provide psychosocial interventions. For example, for the positive symptoms, cognitive behavior therapy, which many of us have heard of as being used in persons with anxiety and depression to help with their symptoms, can be used to help people with psychosis understand and challenge their hallucinations and delusions also. So, the CBT model has evidence base for the positive symptoms like delusions and hallucinations. When it comes to negative symptoms, there is some evidence for the CBT as well. But what happens in psychosocial intervention is we first have to understand what are the needs of the patient. So generally, any mental health professional working with someone who's got schizophrenia or any other severe mental illness, even though I'm repeatedly referring to schizophrenia, this applies to other psychotic illnesses, your bipolar affective disorder, and all those spectrum disorders which are quite intense and affects functioning in a big way. So the first step we all do is we assess what is what are the various areas of the life domains that the person's functioning is affected in. So there's a detailed evaluation. There is you look at their strengths as well. You look at what is working for them at this point. What is it that they're able to do well? What skills do they still retain and are able to utilize to function? So it's important to look at a very strength focused approach. We also understand where are the areas that they need additional support. Then there is a plan being made, looking at what are their strengths, what are the opportunities and support networks that are there to enable the individual to get better. We also look at what are the potential hurdles in the treatment and how can we address it. So once a plan is made, then the team, depending on what the patient requires, will start working with the individual. And again, it's a collaborative approach where the person might want to prioritize, say, getting back to work. Yeah. But to get to work, there might still be a few things that they have to change. For example, their self care might be quite poor. So if they're going into a work environment, they may not be accepted readily. So we will need to negotiate with the person about how important it is to improve their self care to allow them to get back to work. Someone may not have gone to work for a very long time. So the CV might look empty. They may have done their engineering, but changed now because engineering they may have done, say, 10, 15 years ago. So there might be some reskilling that's needed. They may have to do some catch up. They might have to do specific training. So facilitation of those opportunities, identifying what resources there are in the community which the individual can access, improve themselves, improve their CV, so that when they
What does that look like on ground level, ma'am? When we're talking about their community's resources, what does that look like? Like, does it involve the neighbors? Does it involve the extended families? So, who and all are involved in that the community definition here?
apply. Um, the community is as broad as you can imagine, right? Anybody and everybody the person lives with out there is the community. Okay. So sometimes we identify jobs through the extended family. For example, there might be someone in the family who is running a business, right? There might be neighbors who are willing to support. There might be, for example, at SCARF, we now have a structured, focused employment support team. So they go out into the community and identify potential employers who are open to accepting people with mental illness coming and working in them. Of course, there's a lot of work that happens in the background to sensitize them, to educate them about mental illness and the fact that people with mental illness can also work. So all that happens. And there is a pool of employers who are available. So once a person is ready for employment, then a job matching happens depending on who the employers are, what they are looking for, and who are the people who are ready for employment, what skills do they have, what jobs they are looking for, and job employment matches happen. This happens not just in SCARF, because SCARF does this for Chennai and the regional surrounding districts. NIMHANS, for example, also has an employment team which does this in Bangalore. So I think a lot of people are looking at how important work is for someone's self-esteem. And there's a lot of support being done to help people get back to work. So someone may have the skills for the job, but they may lack in their self-esteem, they may lack in their confidence. Then a psychologist will work with them to improve their confidence levels and their self-esteem before they are sent to a job. And even when they go to a job, they will still need to be supported by the mental health team, because they may face issues and they need somebody to talk to and problem solve. There's also a potential where um, people are trying out what is known as a buddy system in the work. So you identify someone in the work who is open and willing to support their colleagues without breaching confidentiality, because sometimes patients are not very willing to share that they have a mental illness. So sometimes that does have a little bit of challenge. But people with mental illness can work in any job provided they have the right qualification and the skill set for the jobs. And there is a supportive work environment. Sometimes returning to work is not just about the skills and the knowledge, it's also about how the environment is supportive. Now, for example, when we talk about people with partial blindness or people with physical disability, movement disability, then the organizations have things in place to support these individuals to perform optimally. So, reasonable accommodations also have to be provided for people with severe mental illness to perform optimally at work.
Right. And ma'am, when these support systems, and this was with regards to the employment part. So, how can the family and the immediate community of the patient be a stakeholder, and how can they, work with the patient's well-being? Because what happens is many times that if it's just the family, just two, three people, and the symptoms are very intense, sometimes it can be very, discouraging, demotivating, or because it's a chronic mental illness, symptoms are likely to come back. Patient is going to be on maintenance medicine in the longer run in their life. um how and I really believe that just the immediate family should not be held accountable for a patient's well-being. The extended family should step in, the community should step in. So on a proactive day-to-day level, what are some of the things that extended family members or the community members, the neighbors, anyone who's willing, what are some of the steps they can take on a day-to-day basis to support the family where there is a severe mental illness?
I'll probably give you an example of exactly what you're saying being executed in action. There is a patient who has schizophrenia. Her schizophrenia is so severe, with the medications, her positive symptoms are controlled, but her functional is extremely impaired. And she lives with her older brother, who has not married because he wanted to look after his sister, because there's no other living family member who can help. So what he has done is he has rearranged his work in such a way that he can be with her at home and still make a reasonable um, income for the family. Now, the big thing that has proven helpful for him and his sister is the fact that the neighbors have been extremely understanding and supportive. So, whenever the brother has to leave home, the neighbors make sure they take care of her. Even the young children spend time with her. In a lot of places, we will find that children tend to make fun of a person who's got a mental illness, or they're run scared. Families tell them that you shouldn't be talking to this person. But this community is very different in that the families encourage and support their children to spend time with her. They have, um, I think they have, the neighbors have hens and small terrace gardens. So the patient is encouraged to come and water the plants, to feed the hens, and actually spend time with the neighbors. When they make anything, they bring food to the family. Now, if they're going shopping for festivals, they take the patient with them. They don't, the brother is able to leave her at home and not really worry about her if at some point his work takes him away from home. So he's able to go and look after all his needs, knowing that his sister is well looked after. Now, this is the kind of community that we need to create all around us. There is another community which is very open to people with mental illness. So they don't discriminate if there are homeless, mentally ill people in their neighborhood. These people are given food, they are respected, and they try to help as much as they can. So there are these small pockets of individuals who are able to make a difference to people with mental illness living in their community, but there's still a lot of work that needs to happen. And at SCARF, what we've done is we've gone into communities and we've done awareness raising in the wider community to help them understand what severe mental illness is, and to help address some of the myths and misconceptions. The teams have used theater, for example, to reach out to the general public in parks and bus stations, where people gather to just raise awareness amongst the community about all these things. So there's still a lot of work that needs to be done all over, but these are some of the things. So essentially, whether it's a workplace, whether it's neighborhood, everybody needs to be supporting people with mental illness.
Yes, ma'am. So, what you're describing, it sounds just beautiful to me. I think that level of involvement and collective support is what we actually need for chronic mental illness and rehabilitation in the true sense. But what about the families where, they are in transferable jobs or so? See, the thing is, if you've lived in the same area for 10, 20, 30, 40, 50 years, obviously there's so much shared history. Some relationship develops, but in today's day and age where it's becoming increasingly isolated and people are moving out of their villages or spaces where they're connected to their neighbors, so people who are living in high rise societies, people who are changing jobs every few years, in that case, what can be done, what can the average person, sometimes because the rapport is something, when the rapport is existing already since many years and then someone gets diagnosed with an illness, there is that existing attachment. But
Yeah.
when someone is fairly new to the community, then sometimes people can hesitate. So maybe this question is not on the lines of what can the average person do, but what can we as mental health professionals who are in private practice, who are in jobs or other mental health organizations, what can they do to encourage this kind of education and building of support systems?
I think it is a challenge. Okay. And I agree with you that sometimes, especially in the cities, it is tougher. If you go into the rural communities, there's a lot more community networking that happens. They are more open to accepting people around them with all their illnesses and difficulties, but it is less of a support system in a city, and the higher the tier of the city, then it is harder. um, I don't know if there is one particular approach that will actually help. It has to be a multi-pronged approach. What can a mental health professional do? What we can do is we can continue to raise awareness for the community through as many media as possible, whether it is the print media or the visual media. We all talk about things, but you may have heard of the Lancet Commission report that came out on addressing stigma and discrimination. And this report concludes by saying that the only thing which reduces stigma and discrimination is actual social contact with people who have mental illness. So, actually, people with mental illness and caregivers putting themselves out there confidently and opening up and talking about what it is like for them, and really showing that not everybody who's got an illness is someone to be scared of. In fact, no one needs to be scared of a person with mental illness. So that message can only reach the general public if the patients and caregivers are able to talk about it. Sadly, we are not at the stage where everyone is willing to put themselves out there. There are a few people who are bold, who are strong and committed to raising awareness. If you know the Schizophrenia Awareness Association in Pune, Mr. Amrit Bakshi, who is the father of,
To actually influence the policy also, am I correct?
sorry, I didn't hear you.
The gentleman whose daughter was diagnosed with schizophrenia, and he also managed to influence policy level
That's right.
changes.
That's
Yeah.
right. He was also involved with the Mental Health Care Act writing up and things. So, yeah, people like that are trying their level best and raising awareness. And I think that is much more powerful than just mental health professionals talking about it. And that's why, even when we do theater performances, it's persons with lived experience who are part of the theater team who go out to perform, whether it's in a corporate setting, whether it's in the bus stands or in the parks. It's the people with mental illness themselves who go out and perform in all these places, because we need to show that these people have capabilities and the general public can interact with them and understand, and really, their mindset, we can attempt to make a change in their mindset about persons with lived experience. So yeah, it is a challenge. It's a work in progress. I don't think we are there yet where we have converted the community, but we need to do a lot more. Effort has to go in for this.
Absolutely, ma'am. That's why conversations like these are so important. Um, So, so if we compare a patient who has no access to psychosocial care, family is extremely ashamed of the illness, is hiding the illness, is harboring a lot of resentment towards the patient. Which I've seen this happen. I've seen this happen in extended families, and I've seen it happen around me. And even if I try to advocate for something different, sometimes my clients can listen to me, and they listen to my input, but family is not going to do that, because ultimately they are used to not taking you that seriously. So a patient who is cut off from society, kept away, put in the back room, and there's a lot of shame and stigma in the family around the patient's illness, okay, versus a patient where family is actually starting to accept, okay, this is what it is, it could have been me, it could have been anyone for that matter, let's accept it, let's focus on the rehabilitation and helping patient have those social support networks, right? How can the two cases differ in their intensity of symptoms?
um, Definitely, the support system will help in a multitude of ways, right? Now, people with severe mental illness, like schizophrenia, often do not accept that they are ill or they need treatment. So, they will need the families to be there with them in the journey, to encourage, to monitor, and support the person to take medicines, because medication is the first line of treatment. But it becomes the family's responsibility to ensure that the person takes medicines on time, consistently, because many of them will need to take medicines for a fairly long periods of time. So the family support is essential in that way. So it when there is support, then the likelihood of their symptoms being under control because they've been taking medicine does happen. But that's not the only thing that the family support can provide. The family support gives them the feeling that they're not in this journey alone. There are people around me who understand me. I can go to them when I'm not feeling okay, and they will not judge me for sometimes being irritable or not being my usual self. They will acknowledge that, hey, you're unwell just now. Once you're better, you're going to be different. So I provide that positive, unconditional regard to the family member, then that is going to help. Now, it's a family who, because people with severe mental illness can have problems with their social connectedness, with their communication skills. Now, the family has to provide them the opportunity to interact with them, provide them the social setting where the individual can go and participate in all the events that happen. And that's where their social skills is going to build, their communication skills are going to improve. So, from that respect, also the family support will definitely improve the functioning of someone who has a severe mental illness. So their role doesn't stop with just taking them to a doctor. There's a lot more that they can do, and that really helps in the recovery of the person. But of course, caregiving can be tough in itself. And so the caregivers themselves will need a lot of help to navigate, how they feel about all this, and the practical stress that they experience. And also they have to battle the stigma and discrimination in the community if someone finds out that they have the family member with illness. So their journey is not easy either. So they need to be listened to, they need to be understood, they need to be supported themselves to remain healthy and effective caregivers for persons with mental illness.
Absolutely. I think caregiver part is something that, but yes, I think again, it's quite unfair to expect one or two people to carry this intensity by themselves. That's why the holistic community support, neighbors, extended families, without shaming, without questioning, because what happens is when people don't sit with their own emotions, ma'am, I've seen that, they become impatient.
Mm,
Sometimes what happens is like, you want to put in effort, you want to see the results, so it's very solution focused, very outcome oriented, and you don't get that black and white kind of outcome. You give up. If you don't work on your own emotions, your own relationship to disappointment, you're going to give up on the patient at some point. So that's, I think I've seen that being a very important part. And we as a society need to understand that if there's a chronic mental illness and if it's a lifetime diagnosis, no matter how much effort we put, it can be possible that when there's a stressor, there might be an episode. And that does not mean that our efforts were invalid. That does not mean that, we have failed, and we should not take it as a personal failing either. So, this is such an important point that I think I forgot completely about the caregivers part. So, thank you
yeah.
so much, ma'am.
And I think the other important thing about caregivers is caregivers often feel that, why me? And this is only happening to me. And it's important for mental health professionals to be able to help caregivers connect with each other so that they understand that they're not alone in this journey. There are others who have gone through this. And sometimes you can learn from each other how to navigate some of the challenges you face. And the same thing applies for people with lived experience. Peer support is such a important concept these days that, when I hear from someone who's been in a similar position before, having recovered, having moved forward, then that gives me a lot of energy and positivity and optimism to also try. I know that if they can do it, I can also do it. So, peer support for patients and peer support for caregivers are both very important.
Absolutely, ma'am. I think one of the areas where actually we focus a lot about, we talk about caregiving the most. And because I have been in a caregiving position, and that is where my entire quest for understanding psychology and, understanding all of this, it started from there. That's the root. So it's something I talk about a lot. And I think maybe one more episode with you, with Dr. Tara or the team at Scarf, for dedicated to the caregivers. That can be our part two of this episode. Uh,
Sure.
but so grateful, ma'am. I'm just one more part. I think my team member is also here. Mrinalini, are you there? So she
Yes.
might. Do you want to ask ma'am any questions?
Yeah, I just like have a small doubt. Is it okay if I don't like switch on my camera?
That that is fine. That is fine.
Okay,
If
thank
you can't,
you.
it's okay.
Thank you so much. I had a small doubt. So I was having a discussion with a friend regarding this, that a lot of time when it comes to mental illness, especially severe mental illnesses like schizophrenia, a lot of times there's a lack of awareness, but a lot of times there's also like a lack of the right mindset. Like people are aware, they might know everything about the mental illness, and yet the mindset still goes what it was several years ago. So like how do we tackle such issues? Because a lot of times like patients do need help, the help is out there, but it's just the people around them are unwilling. So how do we deal with that?
Yeah. I'm assuming you're talking about attitude of people to help seeking for mental illness.
Yes, yes, ma'am.
Yeah. Um, Again, it's not easy. People do struggle to accept, and sometimes um, I'm just trying to think if there is a real um, way to do this. The only thing, like I said earlier, for us all to do as mental health professionals is to keep talking about what mental illness is, that treatment is available, and that it is not something to shy away from, and to normalize the conversation about mental illness out there in any platform that is available, including what you're doing just now. These kind of things are what will eventually change. But that's going to be a very gradual process. It's not something we can't expect the society to change overnight. And even when there is a person with mental illness in someone's family, it's still tough to accept that this is an illness, because many a times, especially with the severe mental illness, we are talking about a long journey of treatment, and a treatment where the person may recover fully but may still have to continue taking treatment so that they don't have symptoms again. So when people are talking about these long journeys with periodic relapses, then the families find it very tough to accept that this is the only option available to them. So sometimes they listen to stories of these long journeys, and so they don't want to go and see a psychiatrist because they're frightened that that's what they will also be told. So they delay help seeking for that purpose also, because they don't want to be told that their family member also needs long term treatment. Now, the only solution to this is people continually listening to information out there to explain that these are illnesses, not everybody's illness is the same. The journey is very different for each individual. And you don't have to be frightened of long term treatment provided the person is recovering and they're able to function effectively. So, if we are able to provide a holistic care, which includes medication, which includes psychosocial interventions, targeting all the different areas of a person's life, be it their daily functioning, their social skills, their cognitive skills, their ability to function in spite of all their symptoms, then I think over a period of time, the hope is that the community will change. But we are a long way away from that, sadly.
Thank you so much, ma'am. Just another doubt. So, in case like a person is diagnosed with, say, schizophrenia or any other severe mental disorder, and the family is supportive, they're just unaware how to go about it, how to support the family members. Um, how do we go about, number one, initiating that conversation with them, that it is not just medications or it is not just the therapist who is going to help, it will be a collective effort, and what are some things they can do to support the family member who has been diagnosed?
Um, there are lots of caregiver education programs which once a family member is diagnosed with an illness like schizophrenia, then the family members are provided focused information sessions on what schizophrenia is, what are the reasons why a person has schizophrenia, because family members also start feeling guilty that somehow what they've done or not done has contributed to this person becoming ill. So we need to address that guilt that families carry. So, ensuring that all those myths are addressed, there is a clear information material being provided to tell them why schizophrenia happens, and then also give them all the different treatment modalities and options available out there that they can access. So, ensuring that there is a good psychoeducation um, provided to the families. It is important to do that with patients also, but families will need a lot of support. The kind of tips that the families need is what should they be doing to support the person with mental illness. One is continuing to provide that unconditional positive regard for the family member, still treat them as an important part of their family, making sure that they understand the medications that are being prescribed to the individual, and supervise and support the person in taking their medicines, not really take away the control altogether, but just being there with them, reminding them to take medicines, ensuring that the medicines are taken on time regularly. And if there is a crisis, they also need to know who to reach out to. What can they do in a crisis? Say if the person becomes suddenly very unwell, they need to wait to see the psychiatrist. Is there something they can do themselves to help the person whilst they're waiting to see the psychiatrist? And some psychiatrists will give advice on what to do. Can the medicines, be adjusted whilst they're waiting to go see the psychiatrist? Like I already said, the family members need to make sure that all family things are discussed with the person. They are kept in the loop. They are having meals together, because that encourages a routine, that encourages a socialization aspect, communication, because when we sit around for meals, we are talking to each other. So the family sitting and eating together is an important ritual which can help address some of the negative symptoms. The family members ensuring that they remind the person with mental illness to follow all the advice that they've been given by the mental health professional, whether it's a psychiatrist, psychologist, or social worker. So, those are some of the things that families can do to support.
Great. Thank you so much, ma'am.
Right. Thank you so much, Dr. Lakshmi. For anyone who's watching, if you found this the insights helpful, um, feel free to follow SCARF's work. First of all, they are the leading organization in my perspective. SCARF has done beyond amazing work for schizophrenia and other rehabilitative, so psychosocial interventions has always been the key strength of SCARF, and that was something that was visualized by the leadership even before mental illnesses were a part of the mainstream conversation. Right now, it's become mainstream because of social media, but even before it became a mainstream thing, I think SCARF has been working since a very long time in that space. So absolutely go. You can follow SCARF's work on their Instagram page. Ma'am, does Scarf has a YouTube channel as well?
It does. It
Okay.
does.
I can tag the YouTube channel as well. So
Yeah.
you
Yeah. It's
can,
on LinkedIn, it's on Instagram. There is a
right.
website for SCARF as well.
Right, absolutely. And if you know anyone who needs, psychiatric treatment, you can feel free to refer them to SCARF. They are based in Chennai, so only like Chennai and the nearby areas, the patient can go there physically. And ma'am, telepsychiatry currently are the consultations open and available to anyone who's seeking treatment?
We have telepsychiatry services, but we have to see the person in person for the first visit, and subsequently we can offer teleconsultations.
Okay, okay. So anyone who needs help and needs a reliable team and wants a more holistic intervention, absolutely go to SCARF. And if you found this video educational and if you feel it is helpful, or if you feel any caregiver, any individual who's trying to make sense of their experiences, or any individual who is trying to make sense of the experiences of their loved ones and is trying to be better at helping them out, please share this video with them so that it can reach the person who needs to hear this information the most. And if you found it helpful, do subscribe to our channel. And thank you so much. For any further questions, you can comment on the video and ask the questions. For any follow-up collaborations that you want us to do with Scarf on the content, one would definitely be on caregiving at some point. But except for that, if you want any other topics, please let me know in the comment section. If you're looking for any psychotherapy, counseling, etc., our email ID will be mentioned on the description box. You can reach out to us via mail. Take care. See you in our next video.
Thank you very much, Srishti and Mrinalini, for this. Thank you.
Thank you, ma'am. I'm absolutely honored. Thank you for this meaningful conversation. And